3 months ago, Mark Hager came to St. Elizabeth's Medical Center in Boston with his wife Karen. It was his last chance. Despite chemo, surgery, and close to 20 procedures for his metastatic colon cancer, Mark now had 4 inoperable tumors in his liver. For Mark, this pint-sized machine called the Nanoknife would prove to be a little miracle.
The Nanoknife is a new technology. Basically involves trying to treat tumors using electrical currents. The amazing thing about the technology is that you're able to place basically 2 probes on either side of a tumor and use an electrical current that then causes the tumor to be destroyed. What's really good about the Nanoknife is that it doesn't disrupt a lot of the architecture of the cells that are there, so you're able to treat the tumor without actually fundamentally destroying all of the tissue.
No heavy lifting.
Mark's team of doctors treated the tumors with the Nanoknife. Dr. Ashley Davidoff performed the procedure.
So Mr. Hager's lesions have decreased by about 70%, each of them, which by the standards of chemotherapy, that's remarkable.
Well, it means a second chance. It means another chance.
St. Elizabeth's is first in New England to offer the Nanoknife. It holds particular promise for treating diseases like pancreatic cancer, where once there was little hope.
I think this is the beauty about medicine and science, is that we're evolving, and things that were thought in one age to be inoperable or untreatable, with new technology, we're showing that we have to think again.
We're only one of 29 centers that are using it globally. And so it's one of these new innovations here at St. E's that we're very, very proud of.
I'm just very thankful that it has been developed because it's a tool that if it wasn't there, I wouldn't have any other recourse.
At each of its locations, Steward Centers for Cancer Care offer a variety of state-of-the-art treatments to the people of eastern Massachusetts, southern New Hampshire, and Rhode Island. Holy Family in Methuen, Good Samaritan in Brockton, and St. Anne's in Fall River all feature linear accelerators, another technology that precisely targets the cancer without harming normal surrounding tissue.
Inhale as you bring the arms up.
Many patients like Leslie Ainsworth appreciate getting their treatment close to home. Leslie had her treatments at St. Anne's Hudner Oncology Center.
I've been to hospitals in Boston with friends and family, and yes, you know, they were met with wonderful care, but I had that same experience here every day for 7 weeks.
In addition, the Hudner Oncology Center has a clinical affiliation with Dana-Farber Cancer Institute and with Brigham and Women's Radiation Oncology, something Louise Gauthier finds reassuring.
I really feel like I have gotten the best of both worlds, and I'm very excited about this even closer partnership between St. Anne's and Dana-Farber, because I think many more people are going to have the same benefit that I have.
Steward Centers for Cancer Care are dedicated to keeping up with the newest technologies like robotic surgery, already used on prostate cancer, thoracic surgery, and hysterectomies.
Birthday cards and so on.
Dr. Sohail Hanjani has delivered 5,000 babies, but he also delivers state-of-the-art robotic care. How can robotics be useful in female cancer surgeries?
The robot allows me to provide patients with a minimally invasive laparoscopic surgery, which is surgery through small half-inch cuts, instead of providing the traditional big incision with the longer recovery and more pain.
Dr. Hanjani says robotic surgery is an excellent tool for removing ovarian, uterine, and cervical cancers.
With the robot, a patient goes home in 1 day, goes back to work usually in 2 to 3 weeks. It really means a far better experience.
Patients undergoing cancer treatment can be overwhelmed by their choices, the technologies, the tests, the appointments with multiple doctors.
Patients, when you're told that you have cancer or even that you might have cancer, the world stops for them, and it's completely overwhelming.
That's why each of Steward's Cancer Centers provides the patient with a nurse navigator, someone like Jan Amarello, who smooths the way.
That appointment is for 10 o'clock, and then your next appointment will be here at the Radiation Oncology Center, and that is to have a nurse navigator who can point them in the right direction, who could be their point person for any questions that they might have, to help coordinate appointments, and take away that piece of stress for them. I can help them put it all together.
It is a long and difficult road for patients like Joyce Buckingham, but today, on her 5-year visit to Dr. Vasconcelos, Joyce has much to be thankful for. No sign of the breast cancer that invaded her body. Nurse Debbie Schultz has been with Joyce from the start.
That's what I love about being an oncology nurse, in that we follow patients up. When you have cancer, it's a lifelong surveillance, and I love living and working in the community. You have that investment. These aren't strangers that we're taking care of. There's always a connection.
Joyce says the decision to come to the Norwood Center in Foxborough for radiation treatment was easy.
I knew this was a new facility and that their machines would be every bit as good as going into Boston, because it was a new facility, and 10 minutes from my house. It made such a difference. And the people here, they were more like a family. So when you come here, it's a quiet place.
These days, Joyce takes time to stop and smell the flowers. And every day is special.
And you just, feel like you want to thank somebody for having a good day and just still being alive. I think that's the bottom line.
Each of the Steward Centers for Cancer Care offers treatments as unique as the patients they serve. Kearney Hospital, for example, offers DNA testing for hereditary cancer and has been recognized as an accredited community cancer program by the American College of Surgeons. Morton Hospital has been designated as a breast cancer imaging center of excellence. At Neshoba Valley, care is provided by a team of nationally certified oncology nurses, physicians, and pharmacists. Having that team approach to cancer care at Steward is critical, says Dr. Sanjay Shetty.
I think the strength of this particular institution is how closely all the different specialties work together. So when you come here, you don't have somebody who says this is the only one way we could treat a particular tumor. And I think that's why it's so exciting to have all those options, because now we really are thinking of cancer as one disease with many different possibilities in terms of how we can try to address it.